A very good day to all of you. Today we are going to discuss the forensic medicine questions which came in the foreign Medicaid graduate exam. And I am Dr. A. Aarti, and I'm currently working in Pondicherry. And I have done my forensic medicine degree from Delhi Maulana Azad Medical College, and then I have done my DNP also, and then now I finished my diplomate exam also. So today I will be discussing with you all the questions that have come in this December examination, FMGE exam. And for those who are preparing for the next year or those who have finished your exam and are discussing the answers with us, all the best to you all. So let's start ahead. So the first question that we will be discussing is this. What is the condition that is noted in this particular picture, right? So here we are seeing an image of a hand which is gripping tightly some grass materials, right? So it's gripping a grass material in its hand. So when we see this condition post-mortem, we think mainly of two. One is rigor mortis and another is cadaveric spasm, right? But in the question, the clue is the word immediate, right? So they have given the word immediate in the question. So the moment we see the word immediate, it's generally cadaveric spasm, okay? So what is this cadaveric spasm? The cadaveric spasm happens when the muscles lose, a group of muscle lose their ATP very fast, that the rigor or the spasm sets in earlier, okay? So what happens in rigor mortis? In rigor mortis, first there is, once a person dies, there is a flaccid state, right? So there's a flaccid state, and then as the ATP keeps on falling, there is a stiffening stage, right? The body becomes very stiff, okay? Because there is no ATP production, and when there is no ATP production, and actin and myosin tend to be bound together, so there's a stiff stage. Now again, after sometimes what happens? The secondary flaccidity sets in. Why the secondary flaccidity sets in? It's because the proteins are getting digested, right? So because of this, the rigor mortis happens in between. So flaccid, rigor, then again flaccid, right? But when you talk about cadaveric spasm, what happens is the person, particularly in this case, I would mostly go with drowning, right? In drowning, he's trying to swim up again and again and again. So the group of muscle, one hand, it loses all its ATP very fast. So he holds a grass over there and it goes in for a spasm there, right? Yells also anti-gravity muscle spasm. Okay, so cadaveric spasm is seen. Now, just because a cadaveric spasm is seen or rigor mortis is seen, we cannot say whether it is suicide or homicide. So we rule them off. Okay, so when a picture like this is given and the word immediate is added and you're seeing any grass or any weapon or any other object in the person's hand, it's mainly cadaveric spasm. Okay, now let's say the option cadaveric spasm is not there, but an object like a gun or a knife or something is seen, then it's likely, again, likely to be a case of suicide, right? Because if a person is in rigor, it's difficult to keep the gun or weapon in his hand. Okay, so that's the first question that we have seen. Okay, now let's see the next question, a very interesting question. Okay, now here what they have said is a physician is referring a patient to the radiologist, and after some days he's just getting an envelope from the radiologist saying that thank you, and he's also receiving some gifts or money out of it, right? So here these are unethical acts, okay, which are covered under the medical rules and regulations, which comes under the code of ethics, right? And that came in 2002, okay? And it's an unethical act and it is known as medical dichotomy, okay? So it's called as medical dichotomy, which comes as an unethical act. Who governs us? Who looks at us whether we are doing unethical act or not? The State Medical Council, right? Under the guidance of the National Medical Council. Yes? So now we have Board of Governors. They take care of unethical act. But criminally for taking gifts, okay, or commissions, are doctors liable? Till now, no. So physician should be finished by law. Physician should be punished by law. Right now, we don't have it. It's an unethical act. They are taken care by the medical council. They will first give a warning notice, and if they find that like not even the first, it's really like, you know, already we have given the warning notice when you get your degree, and this is really a bad thing that we have done. We don't want to give any warning. They can take action also. Okay. Okay. So that's the second question. Okay. The third. The image shows. So the description of this question is that a person has a scar in the lower abdominal region. So when a person has a scar in the lower abdominal region or a linear mark in the lower abdominal region, they look like this. And we think about either cesarean section if it's horizontal, and if it's vertical, it's laparotomy done mainly in emergency cases or in case of carcinomas, right? So the other options which are given here. So this is a question which if you have got an image and if you look into other things, which is very common, you would be knowing, like it's not a tattoo because tattoos are generally colored and they don't look like this plain white, right? The next mole, of course, mole is black, generally tend to be like, you know, round. Ligature marks are generally in the neck, right? So when we have excluded all these three, the option that's left is scar. So if this or a similar image in the lower abdominal region, if it has been given, the option will go predominantly towards a scar. Okay. Okay. The next question, yes, this is one of the favorite question. Even in NEET-PG, they keep on asking. Lucid interval is mainly seen in case of. Okay, so what is this lucid interval? Lucid interval is mainly used when we see cases of head injury and in cases of psychiatry. Okay, so in these two cases, we use the term lucid interval. So what is this lucid interval? Lucid means a fine period. Nice, the person is doing good, right? So in trauma, it's the patient being conscious between two unconscious periods. So he is initially, let's say he's, let me decrease the darkness, yeah. So initially he is unconscious and then he becomes conscious and then again he becomes unconscious. Okay, so this period of consciousness, which is seen exactly in between, is called as the lucid interval in case of trauma, right? Particularly head injury. So what happens here and where do we get it? It is seen particularly in case of extradural hemorrhage. Okay, why, or like why most commonly in extradural hemorrhage? So what happens is this: we have a nice skull, right, which protects our brain. Okay, and below the skull we have the dura mater. Let me take a contrast color. Yes, so we have the dura mater which is over there, and then we have the arachnoid matter, right? And of course, after the arachnoid matter comes our brain, and the pia mater is almost tightly adherent to the cortex of the brain, right? Okay, so this is what we have. Now, the most common cause for extradural hemorrhage is a middle meningeal artery. It's an artery which is here. Okay, so it's a middle meningeal artery which will bleed in the extradural space. So this is extradural space. Extradural hemorrhages are caused due to artery. Now, why an artery again? The skull and the dura tend to be in slight approximation. To separate these two fronts, there needs to be some amount of pressure, and that pressure generally cannot be provided by veins. Okay, very rarely sinus bleeds on either sides will cause hemorrhage, extradural hemorrhage. But in general, the middle meningeal artery which is broken in temporal mole injury will cause the sufficient pressure to separate the dura away from the skull. So you have the skull and the dura is separated and you have the hemorrhage, a pancake or biconvex shaped hemorrhage which is present over there. Now, this is extradural hemorrhage. What happens when the patient is hit or he sustains a trauma? Sudden unconsciousness, right? Immediate period of unconsciousness is there. Okay? Yes. And then he regains consciousness. The moment he regains consciousness, he's working. Yes, he has recovered from concussion, right? So immediately he falls into concussion. He has recovered. He's working along, doing fine. What happens is that this hemorrhage keeps on accumulating. So during his conscious phase, this hemorrhage keeps on accumulating, finally resulting in herniation. Okay, so finally resulting in herniation. So this is what happens. Okay, so the first, during unconscious stage, he's having concussion, right? And after that, what happens? He tends to be normal. Okay, he keeps walking around, but during this normal phase, what is happening? EDH is accumulating, and after that, what happens? The brain, because of the pressure effect, right? Intracranial pressure increases and the brain will herniate. This results in unconsciousness. So this is seen mainly with EDH. It can also be seen in case of subdural hemorrhage. So what happens in subdural hemorrhage? In subdural hemorrhage, generally in trauma, the bridging veins break. Okay, we have something called as the bridging veins, which bridge the gap or they connect the sinuses, okay, to the superficial cerebral vessels. Okay, so these bridging veins will break, and when these bridging veins break, they lead to subdural hemorrhage. These are small veins. Again, they might take some time to accumulate. Okay, but predominantly lucid interval is seen in case of extradural hemorrhage. Okay, in psychiatry, the word lucid interval. Okay, in case of psychiatry, the word lucid interval is used in case of the patient being sane. Okay, he's sane between two unsane period. Okay, or insane period. Sorry. Yeah, sorry. So between two insane period, if he's sane, then that's called as lucid interval. It is very important in psychiatry because doctors or psychiatrists give the opinion that the patient is in a lucid interval, which means he can give evidence in court, he can write his will, he can manage his property, he can get into contract, right? But the same, if he's in the insane period, those all become invalid, right? They all become invalid. So that's the answer for this question. Lucid interval is mainly seen in case of extradural hemorrhage. So what else we have seen with this? Extradural hemorrhages are mostly arterial bleeds, which is caused by middle meningeal artery, which is breaking. Subdural hemorrhage is the second common cause for lucid intervals. Okay. And in psychiatry, lucid interval is the same period between two insane period, and they become important because the person is sane, so he can give or get into contracts, right? So that's lucid interval. Now let's see the next question. Uncontrolled sexual desire in male is known as, okay? Uncontrolled sexual desire in male is known as, or the word can be anything for uncontrolled, or they can say excessive desire, okay? That's known as satyriacism. Okay, satyriacism. Now, this is for males. Nymphomaniac is used for females. Okay, yes. So these two we should be knowing. Of course, voyeurism and masochism, these are very commonly seen. In voyeurism, it is peeping Tom, right? So, and masochism is getting themselves beaten up. Okay. Okay, now in all these things, the first two, yes, of course, if the patient is suffering some grievous hurt or dies because of some masochism, though he might have given the consent for getting himself beaten and everything, it's still punishable, right? Peeping Tom, of course, punishable. Yes, voyeurism is punishable under the section IPC 354 C. Okay, so C is for seeing. Okay, so section 354C punishes voyeurism. Now here, when it is restricted to uncontrolled sexual desire, when it's restricted only to desire, okay, it is not punishable. But once the person acts upon it, does something upon it, then it becomes punishable. Okay, so that's as simple as that. When he's only thinking about it, a person thinks wild, bad, and everything. Those are all mens rea, or like, he has a guilty mind, a dirty mind. But when he acts upon it, okay, when he acts upon it with the guilty mind, that becomes punishable. Okay, these all come under sexual perversions. Okay, so these are all sexual perversions, and that's what newspaper we can read commonly as perverts have been noticed seeing these acts or doing these kinds of act. Okay, so yes, so whenever we are studying sexual perversion or any other law in general, like there is mens rea, and along with it, it's all, you also need actus reus. Okay. Okay, the following crystal is seen in. It's a very common and easily seen one. So let's see the test. What are the names that they have given for it? They have used the word Teachman. They've used the word Takayama, right? So, and of course, spectroscopy. So how do we proceed with it? We have already seen that whenever there is a blood stain, let me take a red, red reflects blood. So whenever there is a blood stain, a dried blood stain, we do something called as presumptive test, right? And from there, we go into confirmative test. Okay. Now, confirmatory test generally is done in the laboratory. So our spectroscopy becomes a confirmatory test. Okay. Presumptive test is just to know whether that red color stain is blood or not. Okay. Now, it can be a beetroot stain or a paint stain. Someone wants to just mix up the crime scene. They would have done that, right? So what do we do for presumptive test? We do spot test, and those are Teachman's, Takayama, and other tests are also that. Okay. Now, even if these are done, okay, they are. No, I'm sorry. Yeah, Teachman and Takayama. Yeah. On spot, generally color tests are done. I'm sorry. Color tests are done as presumptive test, right? So the color tests which are done on spot, okay? So what do? We have used phenolphthalein, most commonly which is used, right? So we put in the blood stain and we look for the color change. So color test on spot, these are presumptive tests. So for confirmatory test, yes, we have three tests which are over here. So one is crystal test. Crystal tests are where we add certain agents and we see certain crystals under microscope. And the other is spectrophotometry. Very good test. Okay. Now, Teachman and Takayama are crystal test. Now, in Teachman, we are going to target for hemine crystals. Okay, and these hemine crystals will look like this: brown, rhomboid shape crystals. Okay, now confirmatory test is Takayama test. Okay, which is again a crystal test. Teachman, Takayama, spectrophotometry. Now, in Takayama, we look for hemochromogen. Now, this hemochromogen, how do they look? Hemochromogen looks as pink, feathery, a pink flower, colorful, right? It will look more of pinkish and it's more of feathery. So these are all for blood. Okay, so all options that were given for confirmatory. Next is Barberio's. So what is this odd man out, the one that is standing out, Barberio's? Barberio's is done for semen sample, okay, and the other name is pick rate test, okay, sperm in pick rate test. Okay, now in this pick rate test, we get yellow colored crystal needles. Okay, so we get a yellow colored crystal needles. So when we get needle shapes, separate needles which are there, and particularly in sexual offenses, those are sperm in pick rates. Okay, yes. So 3 tests over here have been for blood and they have been confirmatory tests. Yes. Now, 2021, the MTP Act was revised, and in 2021, they have asked the question also. So, as per the MTP Act 2021, that is Medical Termination of Pregnancy Act, medical termination is allowed up to how many weeks of pregnancy? This is the question that was raised. Actual answer is there is no limit. This is the actual answer. So, actual answer is there is no limit. So why are we saying there is no limit? Now, as per the new act, okay, if a mother finds even late during her pregnancy that the child is having some congenital abnormality, okay, so if the mother finds that the child is having some congenital abnormality, okay, and she goes and asks the doctor, the case will be referred to a board of doctors set by the state medical council. Okay, so state medical council will have a board of doctors, and the board of doctors, the advisory board, it will come and they will decide. Okay, so they will decide whether the pregnancy can be terminated or not. So if the mother finds even late during pregnancy that the child has congenital abnormality which will cause the child to suffer such harm, okay, that either it will not survive, or even it survives with sufficient pain, then the mother can go in for termination even in late weeks. Okay, now why till 24 weeks will be the best answer? Okay, now till 24 weeks, okay, with the opinion of 2 doctors, okay. Now they brought in mainly for rape. With the opinion of 2 doctors, the mother can go in for termination. So now here, up to 24 weeks, like going to the board and other things are not required. But after 24 weeks also, the mother can go and get a termination, but not with her own reason, not with other reason, but when there is congenital abnormalities. Okay. Now, what are the other significant changes that they brought into MTP Act and everything? So one of the things is that initially before 2021, it was mentioned that unprotected sexual intercourse between a man and a woman, if they are married, husband and wife, was allowed. Okay, so the 1971 Act said like, okay, man and woman married, unprotected, and if they find that the family situations are not favorable, then the doctor can terminate. But now they have included even unmarried couple can go for it. Okay, so unmarried couples can also go for it. That is one. And another is, of course, they have changed the duration. So initially it was like, till 12 weeks, 1 doctor, after 12 to 20, 2 doctors. Now it's not like that. Till 20 weeks, 1 doctor opinion is sufficient to go in for medical termination. 20 to 24 weeks, 2 doctors opinion is needed. So one is this, and second is with respect to time, and then third that they mentioned, of course, after 24 weeks, we have to go to the board. The third they also brought in is for the privacy of the female, okay, and confidentiality. So to keep it safe, they said that like, okay, whatever records are there, it should be kept in a proper way and it should be protected. Okay, her privacy has to be respected and confidentiality has to be maintained. So these are the things that they brought in as a highlights and which they really considered during this time. Okay. So the question is this: at autopsy, this finding is suggestive of. Okay, at autopsy, this finding is suggestive of. So first, our options itself are showing us that it's somewhere around the chest region. So, and the image also. So whenever you get an autopsy image, don't get worried like, oh my God, I have not seen so much of autopsy cases. I'm not an expert at this field. It's been long since I've seen autopsies and everything. The first thing, identify the cavity, whether it's head, chest, or thorax, and last, of course, neck. Okay, so identify which cavity. There's always clues. Look somewhere close by. You will get some image out of it. So here you can see this lung, right? This part is lung. Okay, so here you can see that the lung is over here, right? Of course, you can also see the clavicle and sternum, and it's in the chest. It's of course not abdomen. Here we have it. Okay, and what are you seeing over here? You are able to see a lot of blood in the central region. Okay, let's look into our option and then decide on it. We have pulmonary embolism. Embolism is inside the pulmonary vessel, right? So even if it's a saddle emboli, okay, it's going to be seen inside a pulmonary artery, or a massive emboli, it's going to be seen in the right ventricle. Okay, so one, embolism. Next, we are thinking about aneurysm, pulmonary artery aneurysm, right? So artery aneurysm, of course, you will be seeing the heart, and from the heart you will be seeing the pulmonary trunk which is going on, and it will be bulged up. Okay, it will be bulged up. The anterior structure, which is the pulmonary vessel, the aorta will go behind and then take a turn, right? Okay, so the anterior structure is bulged out. Aneurysm? No, it's not bulged out. You're seeing a massive bleed over here. It's not a vein that you're seeing. It's not a thrombus that you're seeing. You're seeing a bleed. Okay, next, congenital pulmonary hypoplasia. Okay, the first thing that we will rule out in this is that hypoplasia, it's going to be small. The right ventricle is going to be dilated. Again, we are not going to see just blood. So the blood, it's the pericardium which is open, and we are getting blood inside the pericardium, which is nothing but a cardiac tamponade due to hemorrhagic or hemorrhage in the pericardium, right? So this is a case of cardiac tamponade. So what happens in case of cardiac tamponade? There is either massive fluid accumulation, which is rare, but massive hemorrhage. The hemorrhage can happen due to myocardial infarction or trauma or myocarditis, right? So due to any of these regions, the hemorrhage can happen. So most common, most cardiac tamponade, most common, MI. So not MI also, not on the first day, mostly around 3rd to 7th day it happens. Why? Because on the first day the MI has happened, neutrophils have come in. The next, what happens, the macrophages will come and eat that area, right? It makes the tissue over there soft. So when we get a transmyocardial infarct, they might tend to rupture on day 3 to 7, right? So that's the most common cause. Of course, other is myocarditis also can cause that, okay? Okay. And apart from myocarditis, hemorrhage can also be seen in case of trauma, particularly penetrative trauma. Whenever there is a penetrative trauma, the hemorrhage can happen. So what happens the moment the hemorrhage happens? The hemorrhage is happening, you have a nice pericardium, and now here I'm going to use the normal shape of the heart, right? Or the pictographic shape of the heart. Like, let's keep a heart like this. The hemorrhage is happening here. Now, as the hemorrhage is happening, what happens? It tends to compress our pictographic heart. So our heart, what happens? It gets shrunken and shrunken and shrunken. It becomes smaller and smaller and smaller. So it will finally get into this small shape. What happens when the shape becomes small? Everything is fine and good, right? So what happens if the shapes becomes small? A simple thing happens. The heart is not able to receive blood, right? So once it is not able to receive blood, of course, it is not able to send out blood also. And that's where we get our triad, right? So what are the features of the triad that we will get in case of cardiac tamponade? Is simple. Blood is covering it fully. Okay, heart sounds are decreased. Right? Heart sounds are not heard. Next, heart is not able to pump out blood only, right? So the blood pressure is becoming lesser and lesser. Veins are not able to drain into the heart, so our JVP rises. So this is the triad of cardiac tamponade, which is also known as the Beck's triad, and it is seen in whenever there is a hemorrhage or fluid accumulation, massive hemorrhage or massive fluid accumulation in the heart. Okay, the next case. In case of poisoning, the doctor notices excessive sweat. Nice, right? Next, BP is falling. 2. And then bradycardia is seen. 3. What will you use to treat the patient? Okay, in forensic and even in medicine, even in India, the most commonly seen, one of the most common poisoning that we encounter is this, which is organophosphate, right? So in organophosphate, what do we get? More of effect of cholinergic system, right? Acetylcholine is going to be happily roaming around, okay, because acetylcholine esterase is prohibited. So this is the enzyme which breaks acetylcholine. It is inhibited by organophosphate. Okay, so once it is inhibited, you are going to have more of acetylcholine, and these acetylcholine is going to cause all your sludge symptoms, right? What is the sludge symptoms? Salivation, lacrimation, urination, right? Okay, and gastric, the patient is going to have more of diarrhea and emesis. So these are the features which we are going to get. Okay, so what do? We look for the antidote. What is the best antidote? Whenever there is a cholinergic surge, we use atropine as the antidote. Okay, so it's a very direct case. Excessive sweating, BP falling, bradycardia, atropine becomes the drug of choice. OP, poisoning. Okay, organophosphate poisoning. Okay, this is a case of organophosphate poisoning. Okay, now let's see our next question. Chronic alcoholic on sudden withdrawal of alcohol will present after 72 hours with features of, okay, chronic alcoholic withdrawn from the drug 72 hours. Okay, delirium tremens. Certain features, even in OPD, suspect these things very commonly. Delirium tremens. Okay, so what are the features of delirium tremens? What happens and why is he presenting with all these features? Okay, he will have, of course, these two symptoms will happen: tremors, seizures, and along with it, he will also have hallucination. Okay, so delirium tremens is what the patient comes. He doesn't come only with tremors or seizure. He generally comes with a complex of symptoms. Okay, particularly hallucinations. So hallucination is a kind of state where he's seeing things which are not existing only. Okay, so he gets into a massive hallucination state and he's having a massive tremors and seizures. So that's delirium tremens. Okay, Wernicke's encephalopathy. So what is this Wernicke's encephalopathy? Wernicke's encephalopathy happens because of chronic alcohol consumption, not in withdrawal. Because he's consuming a lot of alcohol, the patient will go into Wernicke's encephalopathy. Okay, so whenever you get a case where there is a chronic alcohol after 72 hours, what features and everything, think about delirium tremens. Okay, yeah. Okay, the next question, which of the following should be suspected in a patient presenting with lacrimation? So if you've got again lacrimation, the patient is having diarrhea too. Okay, third, congested eye, but here he's having tachycardia and hypertension. Okay, so he's having tachycardia and hypertension. So now let's look into our, what are the options that are available with us. So one is Datura. Datura, the active principle, one of the, it contains hyoscine also, but one of the main active principle is atropine. Okay. Atropine, yes, it causes tachycardia, it causes hypertension, but it causes a dry, hot person. Okay. It becomes dry and hot. Remember it, OP poisoning, we saw sludge. He's going to be like, leaking water from everywhere. But in Datura, it's going to be the opposite of it. Okay, so he's going to be dry, hot, but of course he will have tachycardia and hypertension. Okay, so it's not Datura. We have ruled out Datura poisoning. Now, cocaine, they've used the word cocaine and they've used the word withdrawal. Cocaine is well known to cause hypertension. Okay, it's indeed known to cause such severe hypertension that cocaine abusers are known to go for myocardial infarctions and indeed stroke also. So it causes hypertension. But the word withdrawal, okay, so cocaine causes hypertension, but the word withdrawal produces opposite effect of hypertension. So which is nothing but the patient will go in for hypo rather than hyper, or he might come back to his normal BP. Okay, so that's cocaine. Okay, then we have cannabis. Again, with cannabis, if they have given like, hypertension and tachycardia with cannabis, then we could have gone with cannabis too. But then they have used the word withdrawal. Again, withdrawal will produce opposite of hypertension. Okay, so again, cannabis is ruled out. So in which withdrawal we do get hypertension, tachycardia, diarrhea, lacrimation and congested eyes. This case of opium withdrawal. Okay, so opium, when the patient is withdrawing from opium, he will tend to have hypertensive features. He will tend to have more of congested eye and like, massive sweating and lacrimation and other features. Okay, so that's opium withdrawal. This is a very nice word because the moment we see the word hypertension, we might link it to cocaine, but they've used the nice word withdrawal and we have to think of the opposite effect. Okay, venom produced by cobra is predominantly, okay, venom produced by cobra is predominantly, simple, neurotoxin. Direct question it is. Okay, venom produced by cobra is neurotoxin. So let's look at our big four of our India. Like we have the cobra, we have the crate, right? We have vipers, Russell viper and saw-scaled viper, right? So if you take cobra and if you take crate, they both are neurotoxin. Okay, they both are neurotoxin, but the only difference is that the cobra venom tend to act in the postsynaptic region. Okay, so cobra is going to come and sit over here, whereas crate is in presynaptic. Yes, they both are neurotoxin. Indian crates can also at times produce features of myotoxins. They are also known to produce that. Myotoxin means they will generally present with renal failure. Okay. Okay. Then you have the vipers. Okay, we have the vipers. V for vasculo or hematotoxin. So what will they produce with? They will produce with bleeding from all region, bleeding from the local site, swelling of the local site, right? So that's what they will present with. Whereas the neurotoxin ones will present first with ptosis. He will have this like, half eye like this. He will be like having, he won't, whenever you ask him to, like raise his eyes, he will try to raise it like this. His, frontalis muscles will be working hard rather than his eyes opening per se. Okay, so that's neurotoxin and we have the vasculotoxin. Okay, the last question. Okay, I've kept this as the last question because it's a combination of both thanatology and your toxicology. Okay, order in the given case will be, so the image, we have to identify the image. So the image is that of a mummified body, right? Okay, mummification. if this is the image that they have given, a mummified body is well preserved, right? What happens in mummification is dehydration. So can you see this? You can see that the skin is fully dehydrated. So complete dehydration, the skin becomes, fully dry, parchment-like, stretched over all the bony prominences, leathery, right? So that's what happens in mummification. And see, mummification was a mode of preserving the body also. So because of that, so we can always think that it doesn't have a order. Mummified bodies don't tend to have an order. So in many medical colleges, even in anatomy department, if you see, they might have a mummified specimen, which will not have any order around it. You can go and you can handle the specimens. No much smell around it will be present. Okay, so that's a mummified body. Why is this very important to know about the mummified body? The identity of the patient is generally maintained if the body becomes mummified. One. The second is that if there is any injury which is present, then these injuries tend to be preserved nicely. They don't get distorted. Okay. Now the other two conditions. So the answer is here very easy. It's orderless. Okay. So the answer is orderless. Yes. Okay. Burnt rope is cannabis. Bitter almond, cyanide, ammonia in case of adipocere. Okay, adipocere formation produces ammonia-like smell. Okay. Now, the other images are this. This is a decomposed body. Of course, we can never get confused with a decomposed and a mummified body, right? So, a decomposed body is going to produce a foul smell or a rotten smell, right? And then this is an adipocere in the leg which we are seeing, right? Now, in adipocere, the lower fats are converted into higher fats. Again, here the body tends to preserve the shape, the identity, and the injuries. Okay, but here you're going to get in adipocere. Adipocere, you're going to get a nice ammoniacal smell or a sweetish smell. Okay, a sweetish smell is going to be there in adipocere formation. Okay, so these are the questions which have come in the exams. All the best to all of you. We will just go through it in just 5 to 10 minutes once again. Okay, starting first condition, we saw pictographic photo in questions are more. So the first conditions which we saw was a hand with a grass material. So whenever we see a hand with grass material and the word immediate is used, we think about cadaveric spasm, right? Cadaveric spasm. Another condition that can be confused, or cadaveric spasm is given as generally as a DD for rigor mortis, but the only difference is that cadaveric spasm happens immediately. It happens in a group of muscle rather than happening all around the body. It happens in a group of muscle which has worked excessively and lost the ATP just prior to death. Okay, so that's cadaveric spasm. So that's our first question that we discussed. And the next we saw that the physician, on referring a patient to a radiologist, receives an envelope with a thank you note and money. Which of the following statement is true about the given options, right? So this is medical dichotomy, fees splitting. Simple thing, dichotomy, fees splitting it means. Okay. So the fees is split. It's fee splitting, it's unethical under the Indian Medical Council rules and regulations, which is a code of ethics which was released in 2002. It's an unethical act and it's covered in chapter 6. Okay, and it is coming under the purview of State Medical Council. Okay, so the State Medical Council will take care of it, but not the criminal bodies or anything like that. Okay. Okay, so in 6.4, we are dealing with this. Okay. The next image shows. So this is an image. If you have seen similar images, it's a scar, a simple scar. Of course, you can never get confused with the mole in this. Ligature marks are generally in the neck region, okay, because that's where the constriction happens and the body is suspended and the death happens, right? Tattoos generally we tend to be more colorful, right? Like it's more in green in color and it generally gives a shape. Not people in general don't get a linear tattoo like this. Okay. Okay, next, lucid interval. Lucid interval is a very important question in NEET also. It's been asked multiple times. Lucid interval is seen in two places we saw. One, in case of head injury, another in cases of psychiatry. In case of head injury, unconscious, conscious, unconscious, right? The conscious period in between two unconscious period is called as the lucid interval. The person is fine during that time, okay? And it's most commonly seen due to extradural hemorrhage. And we saw why it's most commonly seen due to extradural hemorrhage, just because initially due to trauma, he's having a concussion, he's unconscious, but the moment he wakes up, he sits, there is slowly the arterial bleed, which is separating the dura and the skull, and it's accumulating over there like this. And as it keeps on accumulating, there's going to be intracranial pressure rise, right? And that will cause herniation later on. Okay, so it's also known as the walk and die, because people generally walk, indeed talk, and then die. Okay, so there are a lot of actresses and many cases also which are reported where, you know, people sustain trauma, they walk around and everything, and then they die. Okay, so that's extradural hemorrhage. The next, most commonly, is also seen in subdural hemorrhage. Subdural hemorrhages are due to bridging veins. In psychiatry, lucid interval is used for the sane period between two insane period, right? Now, why is that sane period is important? The sane period is the period during which the person can give a will, he can get into his contract, he can manage his own business, the documents signed by him becomes valid, okay? So for this, the role of the doctor also becomes important, because the doctor will come and tell, like, okay, he's good, we can take his statement during this particular time, or the documents which have been established by him during this particular time can be considered valid. Okay, so that's there. Okay, uncontrolled sexual desire, we have seen all these. In case of females, we call it as nymphomaniac, and in case of males, we call it as satyriasis. Okay, satyriasis. Okay, again, we have seen these are all sexual perversions. Mens rea alone is not punishable, but actus reus is punishable. Okay, okay. The crystal which has been shown to us, we saw that there are presumptive test, confirmative test. Presumptive test are color test, confirmative test contains crystals and spectrophotometry for seeing the blood samples. And in crystals, Teachman is there and Takayama is there. Teachman, I, remember, so that's how we really tend to remember. Remember I, and in I we have, okay, so we remember the I, and in I we have He-min also, which is coming in He-min, right? So Teachman, He-min, and in the shape of I itself, but more in rhomboid shape, the crystals become, and they are more in brown in color, right? Okay, so that's Teachman. Takayama, colorful, chromogen, hemochromogen, it's going to be pink feathery crystals. Okay, then Barberio's test is sperm titrate test, yellow color, needle shaped crystals are seen. Okay, MTP Act, yeah, MTP Act came in 2021, asked in 2021 itself. The limit for termination based on the condition. If it's a rape survivor or any other case, till 24 weeks. After 24 weeks, if the mother finds that the child is having severe congenital abnormalities, maybe like, you know, she was exposed to some teratogens later on, or she came late for checkup, or you know, some trauma happened, and the child is going to have such severe condition that's going to make the life difficult for the child, or the child is likely to be born dead, then they can submit an application to the board, or the board will examine, and then the appropriate council which is formed under the act will decide whether the mother can go in for termination or not, but the scope is available enough. Okay, okay. Autopsy finding, identify. The moment you get the image, don't panic, it's very easy. Just look in whether it's the skull region you're seeing, chest region you're seeing, abdomen, or the neck region. Try to identify one organ around it, you will know which region, or look into your question. See, here they've asked pulmonary, 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 cardiac. So you're looking only into the chest region. Then just think about it. When there is an embolism, it's inside the artery. Aneurysm, a bulged artery. They cannot give you a blood picture for that. Again, hypoplasia, they're going to show a image which has a constriction, right? or narrow down, right? In cardiac tamponade, you're going to get blood. So we have seen that this is a case of cardiac tamponade, and we also saw the triad in it. Also, we saw the cause why these hemorrhages happen, right? Now, this hemorrhage happens when predominantly in myocardial infarctions. I have seen it mainly with cases of myocardial infarctions and in cases of trauma. The myocardial infarction, generally after 3 to 7 days, myocarditis, and then in trauma. Okay, in trauma, there's this one interesting question which is asked to us also repeatedly, is that a stab injury to the chest, stab to right ventricle, stab to left ventricle, in which there is higher likelihood of the patient dying faster. Okay, it looks as if we'll go for left, but in right ventricle only. Right ventricular walls are thin, right? So once there is a stab, there is no mechanism for, contracting or, sealing that injury. It's a clean injury, right? It can seal, but there is no scope for sealing because it is very thin. So in left ventricular, stab injury, patient tend to survive till reach the hospital, but in right ventricular, it's almost like cutting out a vessel, a massive great vessel, right? The patient will bleed to death or will develop immediate cardiac tamponade very fast. Okay. In case of poisoning, excessive sweating, BP is low, bradycardia. Whenever we are seeing features of cholinergic system, think about organophosphate first. Let it come as train boxes. The first thing that comes, organophosphate, right? So think about organophosphate. The antidote for organophosphate is atropine. Okay. So, I mean, they have not given other features specific of organophosphate like, kerosene smell or anything, but predominantly I think it's organophosphate. Okay. Okay. Next, chronic alcoholism, sudden withdrawal, more than 2 to 3 days. Again, delirium tremens. The patient will present with seizure, tremors, and hallucination. Okay. Then we are going to see, we got a case where there is tachycardia, hypertension, but there is lacrimation and diarrhea, right? So it's not organophosphate because you cannot have tachycardia and hypertension in organophosphate. So it's not also atropine because if it's datura contains atropine, atropine will produce tachycardia and hypertension, but not lacrimation and diarrhea, right? The person is going to be hot and dry. Cocaine withdrawal. Cocaine produces hypertension, tachycardia, but not the other. Cannabis also the same way, but it is a case of opium withdrawal. Okay. Yes, venom produced by cobra. So we saw the big four, at least you should know for sure. Vasculotoxin, always think about V for viper. Okay. Musculo or myotoxins are generally sea snakes and also at times crate. Okay, certain varieties of crate. Okay, but clearly the Sri Lankan and few South Indian varieties of snake, crate all tends to have myotoxin. Few, again, if they ask you only crate, go for neurotoxin. Neurotoxin, we saw you have crate and you have cobra. Crate tends to be in presynaptic, cobra tends to be in postsynaptic region. Okay, viper, it's a vasculotoxin, and hemotoxin. And our last question that we saw through was our case of mummification, right? In mummification, we saw that the skin becomes dry. So whenever you see such a dehydrated deceased person, it's related to thanatology, remember mummification. In other two cases, in putrefaction, the body is decomposition, the body is going to become massively blown out, purging is going to be there, fluids are going to come out, the tongue is pushed out and everything. Yeah, adipocere, you're going to get a nice ammoniacal smell or a sweetish smell. Okay, a sweetish smell is going to be there in adipocere formation.